After that stay, Lindsay schedules an appointment with Dr. Tuff to give her an update. She fills her in on the ER visit, on the half-day program stay, and the overall takeaway that she still hasn't gotten any better. But the prosecution highlights that while all of this is going on, these intrusive thoughts, this not sleeping, feeling anxious, depressed, and not ready to go to work, Lindsay was still going to the gym, still taking her kids to doctor's appointments, and still socializing with her friends.
She's still bringing the children to doctor's appointments during that time, right?
Yeah.
December 27th, and make an appointment for Callan and Cora when they weren't feeling well. Do you remember that?
Yeah.
And then on December 30th, she was able to take Callan to the doctor that day as well and interact with the staff. Is that correct?
Probably.
And during this conversation at dinner, did she ever mention that she had suicidal thoughts?
No.
Did she ever mention that she had homicidal thoughts?
No.
Did she ever tell you that she was hearing voices?
No.
Did she ever tell you that she was having intrusive thoughts of her own?
No.
Other than having an issue with sleep, did she mention any other issues that she was having?
She mentioned feeling anxious.
Okay, so all of that was mid-December. Now fast forward to New Year's Eve of 2022. And on this day, Lindsay is feeling especially bad. So she goes back to the ER and eventually checks herself into a mental health facility called McLean, where she sees a number of doctors.
She was still talking about thoughts of suicide, and I was exhausted. I said, I think it's time to go to McLean. We didn't have a diagnosis, so we just didn't really know what was wrong. And I think for me, I was hoping that McLean could really evaluate her and try to figure out the best path forward.
Were you aware that night while at the hospital, Lindsay was taking selfies?
No. Are you asking me?
Yes.
Yeah, I can see that.
And then the second page is just her legs in the doorway. Is that correct?
Yep.
As a result of going to Mass General and telling them about her suicidal thoughts, was she transferred to McLean Hospital?
Yeah.
Out of the few days that she was there, 5 days she was there, you visited 2 or 3 times. Is that correct?
Yeah.
I'm going to draw your attention to a particular patient by the name of Lindsay Clancy that arrived at McLean in the early morning hours of January 1st of 2023. Do you recall that patient?
Yes.
What was the chief complaint of the patient when she arrived at McLean?
Finding it hard to sleep if she didn't take medications. Ms. Clancy complained, there were several symptoms. One of the things that she did complain about was the numbness.
Did she report any delusions, hallucinations, or suicidal or homicidal ideation?
No.
Going to January 3rd, that was the first face-to-face contact you had with the patient, correct?
Yes.
And what were your observations of her mental status?
She was appropriately dressed. Her speech was of normal rate and volume. Behaviorally, she was polite and cooperative. Her mood, she appeared anxious. I gave her a diagnosis of insomnia with a mental health condition. She stated that she was anxious being in the hospital and that she wanted to be discharged so she could be home with her family and her children.
And when she asked to leave earlier than Friday, what was your response to that?
I said she could leave provided she had psychiatric follow-up the next day. I wanted to ensure that if she wasn't able to sleep that night after discharge, that she could speak with somebody about it so that they could come up with a plan to ensure she could sleep and to monitor how she was doing off the medication. I did not have any concerns about her safety or a risk for anybody else.
Lindsay is discharged from McLean on January 6th, and in the days following that discharge, she attended Cora's birthday. She mentioned to a few of her friends that she was having some internal struggles, and she had a few more appointments with Dr. Tuff.
So she was continuing to feel depressed. She was feeling numb. She still appeared quite depressed.
And I believe in this note for under condition, you wrote deteriorating.
Yes.
And why is that?
So it sounds like a very strong word. I will give some context that it's not my choice of a word. I have 3 options when I'm filling that out. I can say a patient is improving, unchanged, or deteriorating. So she wasn't improving and she wasn't really unchanged. She appeared a little bit worse than the last time I had seen her. So the best word is to say deteriorating.
Did she send you emails on January 11th, 2023, asking you about your knowledge and thoughts on ketamine therapy and whether that would be a good option for her?
Yes, she did. But I didn't think we were at that point yet.
Did she say, I'm still feeling a very low mood, no motivation, just very depressed. This has been going on for months now, and I'm getting desperate for something that would work quickly to get me out of this depressed state. Do you remember that being part of the email?
Yes.
And what was your interaction with Ms. Clancy on January 16th?
Her mood was still very low. She was still depressed. It was, she was able to get out of bed and take care of her basics like hygiene and eating. Her concentration was fine, and she was doing what she needed to do to take care of her baby, though she subjectively felt like the bonding was forced with the baby.
Okay, so that gets us to the 2 days before the day of the incident. And these lead-up days are critical because, according to the prosecutor, everything about Lindsay's actions during those 2 days shows that she was fully aware of what was going on. She was not experiencing any symptoms of psychosis. She was not hearing voices or anything that would indicate that she could not fully grasp the consequences of her actions. And so starting with January 22nd, 2023, the prosecutors put up witnesses to attest to how Lindsay was behaving, including some friends she saw at a bonfire, a friend she texted with about hoping to feel better soon, and they're able to question Dr. Tuft about these 2 days, because Lindsay's last appointment with Dr. Tuft was the day before the incident.
And directing your attention to Sunday, January 22nd, 2023, did you have a small gathering at your home?
Yes, their family came over to my house.
Do you recall describing the day previously as a perfectly normal afternoon, really nice?
It was a nice day, yeah.
Okay.
And throughout the course of that day or that afternoon that you were with her, did you notice anything change about how she was communicating with you? Like, did she start to talk faster or seem confused in any way?
No.
Was there anything that happened at that interaction that made them abruptly leave?
No, I think it was like nap time for the kids.
Okay. So in terms of January 24th, 2023, when the children were killed, how close in time were your text messages to that incident?
Only a few days.
Okay. And what was that text conversation?
She had shared that she had been taking a medication that caused her to have some dark thoughts, but that she was going to, or had been tapering off that medication and was trialing new ones that would remove those side effects and be more helpful and therapeutic to what she needed.
Did she ever express at any point that she wanted to harm herself?
No.
Did she ever express that she wanted to harm the children?
No.
Did she ever tell you that she was hearing voices?
No.
I did not speak to Lindsay. I sent her a text message on January 23rd.
And what did you say in your text message?
I'm paraphrasing, but I believe I said, "Hi, I've been thinking of you, wondering if you're still in the daily program," I believe I said. So maybe I didn't realize it was inpatient. And she responded.
And what was her response?
Again, I'm paraphrasing, but she said something like, "I'm no longer in the program. I'm continuing to work with my psychiatrists to find the right medication that will allow me to sleep at night but still function during the day. I've had a lot of bad or negative side effects from the medication, so I've had to come off of them and go on new ones, and it's been very difficult."
Okay. Your next appointment with her was January 23rd, 2023. Is that correct?
Yes. She has to force herself to get out of bed and out of the house, but is able to do that. And she is sleeping okay.
And did you ask her if she had suicidal ideation or homicidal ideation on the 23rd?
Yes, I did.
What was her response?
No.
At any point in time, did she tell you she was planning to kill herself?
No.
At any point in time on the 23rd, did she say she was planning to kill her children?
No, absolutely not.
At any point in time during your interaction with her in that session, was there anything about her affect or demeanor, her behavior, that indicated to you that she was a danger to herself or others?
No.
Was there any reason, based on your evaluation of her in that session, that would give you grounds to file a Section 12 on her that day?
No.
And then comes January 24th, the day of the incident. Lindsay had spent that morning at the doctor's office with Cora.
And speaking specifically to January 24th, 2023, that was Cora's 5-year physical, is that right?
Yes.
And sometimes in the record it's called a well visit?
Yes.
Did you notice anything out of the ordinary about Lindsay Clancy's demeanor or behavior or interaction with you?
No.
Was she able to answer your questions?
Yes.
Did you have any trouble understanding her at any point?
No.
Did she seem to have any trouble understanding you?
No.
Did you have a discussion with Lindsay Clancy about Cora having some stomach aches?
Yes. So we talked about the belly pain she was having. From what I could tell, I thought constipation might be possible because it's something we see a lot in kids. So I had suggested we try Miralax, which is a common stool softener we use, and wanted her to see me within 2 weeks if Cora wasn't feeling better.
She then came home, played with the kids, and by evening, she asked Patrick to go to CVS to pick up that Miralax and then go to the restaurant to pick up the takeout. She even called the CVS and the restaurant before Patrick left and held perfectly normal conversations.
And did you give her any specific brand names or anything like that?
I just said that we carried Pedialyte, and I was 13 and 20.
Her voice, did it seem slurred or impaired in any way?
Not at all. It's a very normal interaction.
And directing your attention to 5:10 p.m., did you receive a call for a takeout order?
Yes.
And was that a male or a female?
It was a female.
Did she appear to have any trouble understanding you or the questions you were asking her?
No.
Did her voice sound slurred or impaired in any way?
No.
So that's the prosecutor's argument as far as the lead up to the murder. But they don't stop there. Prosecutors say what happened after the incident also shows that Lindsay was of sound mind.
A few days after this happened, did you receive a phone call from the defendant while she was at Brigham and Women's Hospital?
She didn't talk about our kids. She talked about what she went through. She said she heard a man's voice telling her that if she didn't do it now, she would lose her chance or something like that.
Did she mention the children at all during that call?
I don't think so.
On this particular night, February 2nd, do you remember her making a particular request of you or ask you for something specific?
I think that was the night she wanted to reach out to her lawyer.
Okay. And did you note that in your nursing notes?
Yes.
I want to direct your attention to March of 2023. Did you visit Miss Clancy while she was at the Spalding Rehabilitation Facility?
Yes. I remember her asking about my daughter. I remember her asking about any updates to life events for our friends. We talked about some hobbies that she was doing while at Spalding and then played a game.
At any point in time, did she mention the death of her children?
No.
At any point in time, did she break down in tears and cry about her children?
No.
Okay, did y'all make it to the end of this? What are your thoughts? Can a person be fine 1 minute and then go into a psychosis the next? Do you believe the prosecutor's theory that Lindsay got sick of trying to get help and just gave up and decided to kill herself and her kids? Let me know what you're thinking. And if you really made it to the end of this video, let me know if you want me to make a part 2 that highlights some of the points the defense has been making on cross-examination, like this one.
So forget all about my sloppy writing. I'm looking here on October 21st of 22. Is that correct, right up there?
Yes.
Okay.
Yes.
And can you just read this paragraph here for us?
No sleep last night. Falls asleep after 40 minutes. Heart racing, severe anxiety. Worrying about kids, baby, sleep. Yawns but not drowsy. Not hyper, pressured speech.
What was that? Not hyper what?
Not hyper, not pressured speech is what I meant. I know it doesn't say not, but that is exactly what I meant.
When did you see this that you noticed that it did not say not?
I don't care what it says. I know what I meant.
Well, when you wrote this, you did not say not pressured speech. You said in the medical record, pressured speech, right?
No.
Does it say that?
Yeah, the word is the word not is right before not hyper, comma, pressured speech. The two are following the not.
To you? When you put down in a medical record, heart racing, comma, severe anxiety, comma, worried about kids, comma, baby, comma, sleep, comma, yawns but not drowsy, period. Not hyper, comma, pressured speech. That's what you wrote, right?
She did not have pressured speech.
Did you write that, doctor?
I wrote that, but you're misinterpreting my note.
Am I reading this correctly, and the jury will be able to look at it, that you put not hyper, comma, pressured speech? Did I read that right?
Yes, but your interpretation is incorrect.
As opposed to yours? That's all I have.